I am optimistic, positive, and excited. Excited about chiropractic, excited about myself, excited about the future, excited about the opportunities, excited about the ability to learn and apply it and achieve higher level results. Of course, I'm also excited about reaching people with my practice and building an exceptional life of productivity and prosperity and generosity. See, they go together, don't they? Prosperity and generosity. I find in the world today we see a messed up relationship there. It seems that the more prosperous many people become, they don't give away as much. Some do. I would have to say most don't. I heard an interesting observation the other day. This gentleman did some research and found that there's like 330,000 churches in the United States. There's 600,000 homeless people. 330,000 churches. 600,000 homeless people. If each church just took care of 2 people, it would handle every homeless person in the United States. I know it's not that easy, but it is an interesting observation, isn't it? And I see this with wealthy people. They have a hard time giving anything away. They worked hard to get it, to hold on to it, to grow it. And you almost have to break their fingernails to get them to give up any of it. See, people act like they're going to live 500 years. That's called being delusional. You have a limited life, and if you acquire more resources than you will ever need, and say you establish some legacy for the people behind you that you care about, well, then you have an opportunity to be generous. Quick story here as we move through the affirmation. Yesterday, I look at my cell phone. I'm at home right now. At that point in time, here I'm in my office making the podcast, but yesterday I was at home, and I see my phone light up. I happened to be in the middle of a guitar lesson, so I didn't think anything of it. I ended my guitar lesson. I'm still no good at guitar, but I told myself I would try. Then I look at my phone when the lesson is over, and I see there's a missed call from Katie here of Winner's Edge fame. And then I see a text message over the top of it that says, SOS. And I go, oh no. Oh no. I call immediately. What was it? She was on the side of the road rescuing a turtle. She's got this big turtle that she thinks might have got hit partially by a car. She pulled over. This is a big guy, bigger than a basketball, like a 30, 40-year-old turtle. She's not sure if she can pick it up. It's a snapping turtle. The thing will literally bite your finger off. And if you grab it, it can reach around and still get you. That neck is long. Some other guy stops. A couple other cars stop because the turtle's so big you have to drive around it. So she pulls over, some other people pull over, this guy grabs it, and in the process of moving the turtle off, the guy drops the turtle on its head. We're wondering if that hurt the turtle more than just whatever may have happened while he was in the road. That causes the turtle's head to start bleeding. He feels bad. You know, you grab that turtle, you can't drop it. I mean, come on now. Jeepers. That's like people putting somebody in the gurney and dumping the gurney as they're trying to put the person in the back of the ambulance. You've seen those videos. They're like hilarious, but they're not hilarious. Anyway, so I get the call. Do you have a cardboard box? I want to save this turtle. So I grab a cardboard box and I go rushing down to 7525 Mitchell Road in Eden Prairie, Minnesota. And sure enough, there she is. And there's the big old turtle sitting on the side of the road, and she's not sure what to do. And I realized this box I got, it wasn't big enough. Now there's a place here. Now, by the way, I'm going to get to the story today here. And I'm going to finish this affirmation in a minute, but follow this. Ties in with this concept of prosperity. So I have her back her car up, and I grab this turtle. I bring a pair of gloves, and I say, I'm not going to drop you. And he had legs moving, his head was moving, so I figured he might be okay. This is a savable creature. We put him in the back of her car, and there's a wildlife rescue place here in Minneapolis, and you can take practically anything in there. Rabbits, foxes, turtles. So we jump in the car, and we're headed to the wildlife rescue place. She's on the phone telling them we're on our way to save the big turtle. I don't know why we didn't take pictures or videos of this. They close at 6 o'clock. The map says we'll be there at 5:59. It's gridlock traffic the Friday before Labor Day going through the big city. I mean, come on. But we get there. She goes in. They're still open. Nice gentleman comes out, grabs the turtle. Seen many of them before. We go inside, fill out a little bit of paperwork, and I just say, do we owe money or something? They only take donations. I said, well, I'll make a donation. The lady says, how much? I said, I don't know, $250. And she goes, wow, that's the biggest donation we've had all week. It's only $250. But most of their donations are like $10 or $20. Now, I could have given them $2,500. I could have given them $25,000. I could have given them $250,000. But it makes me realize out in the world how few people give. Be a person who gives a little with some consistency as you become more prosperous. And maybe there was a time when I was just starting out in practice and maybe it would have been $20, but I would have given something. Those are opportunities because the hole you give through is the hole you receive through. And hopefully here next week we'll get a good report that the turtle is okay. We've agreed to go back and get him and take him back to his home. We didn't know this, but apparently these turtles, they have a summer home and they have a winter home. And if you let that turtle go 20 miles away, it will start trying to walk back to its home. It knows where to go. But of course, it has no chance to get there in the city. Fascinating. All creatures are fascinating. From a centipede to a turtle to an Arctic falcon to a whale to a beautiful deer to an incredible, scary-looking black Doberman. All God's creatures deserve our respect. Exceptional life of prosperity and generosity while filled with love, fitness, and fun. Of course, our purpose is to become smarter, more powerful, more capable, more driven, and superior versions of ourselves by ever increasing our awareness and knowledge and understanding and motivation and hands-on skill and communication skill and mastering the art of exceptional living. That's part of exceptional living. Helping creatures out, helping people out. Got to be careful with it. You can overdo it. You can be taken advantage of. But with good timing, you can help other people maybe take a step closer to an exceptional life. And of course, every time we train on the Chiro Success podcast with Tory the Chiropractor, It's causing you to naturally attract great new patients. It's making you more capable at motivating and persuading people. You're empowered to make smarter long-term decisions. And of course, you're energized physically, mentally, and financially. Big topic today, something we talk about here. In dealing with the public and having to use language. Objection management. Dealing with objections when you're talking with people in the public who you may not know. Dealing with objections when you're talking with friends or family. And everybody's had this happen. Dealing with objections when talking with patients or people that want to become patients. Possibly even good long-term patients might have questions that require some objection management. And very commonly, you've got the husband or the wife or the boyfriend or the girlfriend or the mom or the dad or the grandpa or the grandma, okay, or the son or the daughter who wants to grill you with questions as they're standing there next to their family member who is a patient. They're not, but they have questions for you. One time I had a gentleman, he was a judge, and he had some serious questions about the care of his daughter as his mom and daughter were seeking care. He comes in during the report, and he has a few questions before anybody starts to work on his wife and his daughter. And I don't blame him. I had to have excellent objection management, question management, to develop that trust. And I must have done all right because then he became a patient. So the first point I want to make here is this. We have answering questions, and then we have the concept of handling questions. We don't answer people's questions. We handle questions. Regardless of what somebody asks you, you handle the question with a response that is what you want them to know. You are under no obligation to directly answer anybody's question. There are many examples, and we don't have enough time to do it. But someone could say something like this, and it could be even this type of a remark. Boy, you must be doing pretty well out here by the looks of your car out there. What are you going to do? Backpedal, apologize? Just say, yeah, it's just a car. Just a car, big deal. Not like it's a Bugatti or anything. Sometimes you have to recalibrate people because they're just testing you. Boy, with a truck like that, you must be doing pretty good around here. It's just a truck. Big deal. It's just a car. See, you just handle it. You just squash it. Versus, well, I'm going to feel guilty about having a nice car. Maybe I shouldn't have got that. I'm embarrassed now. None of that nonsense. See, what I'm trying to get you to do here and to feel and to engage through this brief training is that you don't backpedal. I am shocked, as I go through my points here, how easily I can get people to backpedal if I ask a few questions. So you have to handle questions by having a smart response that always holds your ground with confidence. But of course, you want to be nice. But many times you don't know what words to use because you have to learn. That's why we have our communication and persuasion system product set, our office visit talk product set, and our table talk product set. These audio sets are the definitive communication sets for the power chiropractor. And if you don't have all three of those, I mean, your life will change overnight when you learn how to say things better, when you learn how to have the responses to all the questions people ask, and when you learn what to say to people on every office visit to literally program them to come in and see you forever and refer family and friends. You have to have those. Our yellow set, as we call it, the communication and persuasion set on our website, We think it's the most popular audio set in chiropractic today. Like everybody has it. It's life-changing. I'm really, really good at this. And I've got stuff down in audio form and video form for you to learn from and use. It's cheap to buy product sets. Are you kidding me? Of course you should have it. So we handle questions, point one. Next is this, we're coated with Teflon. And people will test you. Oh, you're running a mill around here. Just say, yeah, everybody loves it that they can get in and get out and get back to their life. I know people that come in where they should have been paid by their last chiropractor who was wasting all their time in the office. See, I just jump on it. Whatever their thing was, I answered in a way that they regret even saying it, but I'm being nice. And there's lots of ways to handle that question depending on who it is. Is it a male saying it? Is it a female? Are they a patient? Are they not a patient? Are they kind of joking but they want to see your response? Or are they being mean like you're rushing people? Great example. Chiropractor got a bad review. Oh, he's running a mill. He hardly spends any time with you. Do you think he responded to the bad review? No, he could give a rip. Most chiropractors, Tory, what do? I got a bad review. Nobody will come and see me. I'm going to go out of business because everybody's going to read this bad review and not like me anymore. What am I going to do? The crybaby chiropractor of the new era. One of his CAs responded, Dr. So-and-so is so in demand and so famous for results that he has to be very efficient with his time and make sure each and every patient gets the best spinal adjustments possible. You are very fortunate that he accepted you as a patient, and we highly recommend you continue and follow his recommended care plan. Period. Handled the question versus, oh, we're sorry you think that way. Wah! Wham! See, my confidence in this area far outweighs any doubts you might have. That's a DeMartini term. When people might have a question or not believe. Well, my confidence or my certainty in this area far outweighs any doubts you might have. It's very important you know that line. Memorize that. My certainty in this area far outweighs any doubts you might have. Or, my certainty in this area far outweighs any concerns you might have. Or, my certainty and my experience in this era, that's funny. My certainty and my experience in this area far outweighs any concerns you might have. Okay? All right, very, very good. There's always an opportunity. Every question or every comment a person makes is an opportunity for you to get them to understand that you're an expert and for them to develop trust and want to follow you. And they will test you to see if they can get you to cower or back up or throw you off. Okay? The male challenging the female chiropractor. The female challenging the male chiropractor. The guy challenging the guy chiropractor. All of these different... A child challenging the chiropractor with tricky questions sometimes. So you have to be very, very smart. All right? Now, I want you to observe when you're out in the world and someone's trying to sell you something. Life insurance. Could be a dentist. Could be at the vet. It's very interesting to see how people approach you with what their plan is and what the money is. I find this highly entertaining, where I can sit back and go, okay, let's see how their report goes, and let's see how they ask for money. They're nervous. They're confident. If I can tell that they're unsure about the fee or if it's worth it. If I can determine whether or not they think that they're imposing a burden on me by telling me the fee, like they think it's a lot, so they're going to think I think it's a lot, and they're kind of sad to say, well, it's going to be $8,000 versus it's $8,000. and this is a issue with the chiropractor also, being able to simply ask for money because you think your care is worth it. This is a ubiquitous disease in the chiropractic profession, where the chiropractor, because it's their own personal service and not a product, they have no problem saying 4 bottles of pills is $120. But if they had to say my adjustment fee is $120, they would all start to cower and cringe and then go hide in a back room somewhere, even though you have given adjustments that are worth $10,000 or more. So we have to believe so we can ask for money, and we have to be very observant when people are asking us so that we can become better at our own skills and be aware of how we're coming across. How do you come across when you're doing a report and when you get to the money? Is it casual? Is it cool? Is it just, it's just my job to tell you. If you want to take care of it all at once, it's $7,400. Okay, if you'd like to make a few payments, that's going to be a little bit more, $78. You can pay per visit if you like, but nobody ever does that. It's up to you. Okay? Now, I made a mistake there. I made a mistake there because I sort of reversed the normal way I would say that. With the prepay amount, I actually said the word 100. Of course, we would never do that in real life. Because when we're talking about a prepay or an auto pay in your office, we never say dollars, we never say hundreds, and we certainly never say thousands. So let me reverse it. It would sound like, and we have a formula for this, and I was off the formula, but I got to correct myself here. It's $8,400. That's if you paid each time you came in. But of course, nobody ever does that. What everybody does, Jennifer, is they just pay it all at once. It's only $74. And if you'd like to make some payments, that's perfectly fine. It's just a little bit more work up front. It's $78. What's going to work better for you? It's just $74, not $7,400, and not $7,400, and not $7,400. It's just $74. And by the way, that is a legitimate chiropractic office care plan. That is a part of our $200,000 per month level 6 Winner's Edge protocol. $74 for the prepay on the care plan. But that's a topic for another day for our high performers in the group that want to be the most successful chiropractors in the world, because that is who we train here. Now, a couple of responses I want you to know here. My confidence in this area, you get the idea. You want to be handling questions, not just answering. But I want you to know this, and most people who know us know this. This is a common phrasing as people might be questioning you. And they might say something that takes quite a bit of time, or that's a fair amount of money. All right? And we have a 3-word answer, and everybody in the group already knows what it is, and they're already saying it out loud as you're driving around, let's say. But it's this. Memorize this if you don't know it. Compared to what? Boy, that's a lot of money. Compared to what? A $50,000 or $100,000 surgery that has a 60% chance of failing and ruining your life? You know? Compared to what? Compared to going to a physical therapist for 30 or 45 minutes, okay, to play around with the muscles and everything else, they're going to go right back to where they were, because muscles don't control anything. They only do what nerves tell them to do, and the nerves are coming out of the spinal cord system where the chiropractor has a positive effect. You know someone is stupid when they say something like this: something's not firing. Oh, your glutes aren't firing. Like what? The only reason something wouldn't fire is because there's a subluxation cutting off the power there. Kidding me? You think the muscles have little brains of their own? It's just, the people in the therapy land that think muscles control stuff, and if we just play around with it, then somehow it'll make a lasting change. Chiropractic spinal adjustments are like the only thing that can cause a legit change in the homeostasis of a human being and literally change the neurological power that's going anywhere those nerves go, okay? It does not matter what you eat if the nerve power going to your stomach is not at 100%. It does not matter what dopey exercises your trainer shows you or dopey movements some therapist shows you if you do not have full power going to those fibers, to those tissues. Do you get what I'm saying? It is chiropractic, structural, nerve power first, then it's exercise, movement second, muscle, whatever, and then it's massage, and then it's like, let's have some supplements or something. You get the idea? You have to understand the hierarchy, and that is the hierarchy. And you know it's the hierarchy because the world system is trying to reverse it. Just like they got the food pyramid upside down to destroy you, they have the hierarchy of what you should do for your health upside down to also destroy you, because you have to understand who's running the system and they are out to destroy you. So whatever you see as common and popular, if you invert it, you have now what is right. They're trying to eliminate praying in Christianity. Well, that's how you know that Christianity is the only legit spiritual belief on earth. Everything else is a corruption, and I mean everything. Okay? And some of you, my astrology, my kundalini, my that's all what's called superstitious awe. And it is not Christian, and it will not get you anywhere when you die. Okay? There's only two religions, one that's right and everybody else that is wrong. And that is just the harsh reality of it. And when it comes to the food pyramid, there is what is right. Fruits, vegetables, healthy, real, quote, God-made food. And then, of course, when it comes to your health, structure and function, followed by more invasive techniques as they may be necessary. And hopefully they're not. So compared to what? Boy, that's expensive. Compared to what? That's going to take a lot of time. Compared to what? If you hurt your knee, it's an automatic year. And I'm laying out a plan for 90 days? What are you talking about? This is unbelievable. See, people will question it, and it's because they don't understand. They're poorly calibrated. So you have to recalibrate people. Boy, that's a lot of visits. Compared to what? I had a guy in a car wreck. I've seen him 220 times. Okay? And he's halfway to getting better. What are you talking about? You know, that's a lot of visits. Compared to what? I'm going to work out 250 times this year. And I'm recommending a 24-visit care plan for you? See that? You have to recalibrate people because they don't know what to think. They don't know what's good. They don't know what's bad. They don't know what's right. They don't know what's wrong. They're coming from their place, and you've got to get them to believe what they are supposed to believe, which means you have to stand your ground, which means you have to be coated with Teflon, which means you have to be a casual observer of the facts, very cool, which means you have to obviously believe in what you're doing and believe in the fee structure and believe in chiropractic. You have to have smart responses that are gentle and nice, and then you have to recalibrate people to get them to believe what they need to believe if they want to go to a higher level of health. And for you, you have to behave like this. You have to conduct yourself this way. You have to become a master communicator because this is what leads people to higher ground, and this is what helps you ultimately build the exceptional chiropractic life. Tory out!